What's going on, everybody? My name is Dr. Eric Krieger. I'm with my co-host, Mr. T himself. We're here with the HealthFi podcast. We're super excited to have another gentleman named Ahmed Abdulla on. He runs, and I believe founded, but he'll let me know, the Digipharm and also DigiHealth platforms. Ahmed, how you doing tonight, my man?
Good, thank you. Excited to be here.
Yeah, we're super excited. As we talked, briefly before we started, I'm a physical therapist, and Sean's also in the healthcare entrepreneur business. Tell us a little bit, about yourself, your background, how you got started, and then kind of what led into the product base we're going to talk about a little bit later.
Oh, cool. Thank you for having me today. First of all, I want to say it's really cool to meet healthcare and crypto enthusiasts at the same time. There's not many of us, so meeting you guys is really cool. My background by trade and training was as a health economist, initially helping the NHS in the UK understand what they could pay for and afford with their limited budgets, mainly in the cancer space, high-cost drugs, and then moving into the pharma industry, working for an organization called Roche, who manufactures some of these high-cost drugs and helping them get some of these into global markets. I led the lung cancer team, the global lung cancer team, for one of their new therapies. And during that whole process, I saw there was a big need for what we do at Digipharm.
Amazing. So it was kind of that natural transition point where you hit a limiting factor and you saw that opportunity. And when you identified that limiting factor, what did you feel like they couldn't accomplish that kind of brought you into Digipharm? Was it the limited access to resources? I know I saw administration issues were causing high costs. Like, what caused you to start that?
I think it's a combination of those things. So obviously, when you're dealing with high cost therapies, typically you have a limited market that can afford them. And these are organizations that really want them, but at the same time, they're reluctant to pay so much for these things and be hit with, the implication of paying for these therapies even when they don't work, right? And it was an environment where there were also many competitor therapies as well. And, patients responded differently to each of these drugs, even though they have the same disease. And there was an appetite from many of these organizations to pay for these based on how well they work, rather than, what patients or how many doses were given to patients. But there was no infrastructure or solution to help them do this. This was also around the time where something called value-based healthcare was really, it was taking steam in the, let's say in papers, thought pieces and things like that, but it wasn't really being implemented in the real world. And in early 2017, I came across Ethereum and smart contracting, and I saw that, wow, okay, this could be a really exciting solution for what we want to do, because it provides the confidentiality around, some of these agreements that we're deploying, but at the same time, it provides transparency for each of the stakeholders within the network. And then that automation piece again made it really exciting, and it was transparent automation to people within these, who are part of these agreements. And I thought, look, let me try and create some sort of system or solution that can help address this and take it to market. So took the gamble of doing that, leaving my job and trying to take this forward.
Nice, man. I think that's such a unique risk in the sense of it's a clear need in our industry, especially talking about even that patients that I see in the healthcare field. So with that solution, from a smart contract perspective, and this might be kind of tailoring off to later, but I'm really curious about it. Are you looking at from the business side of things or also from the patient side of things? I know you have two separate products that we'll delve into. How are those smart contracts getting set up?
Yeah, so it's a bit of both. So obviously, when you're paying for something based on how well it works, when it doesn't work, typically the hospital or the insurer or the government, whoever's the payer essentially in that instance, will pay less. And that impacts the pharmaceutical company or the manufacturer. And if, for example, something does work, then they pay a higher price, and the pharmaceutical company or the manufacturer gets that benefit. And I identified there was an opportunity for somebody to act as an independent third party to help process these types of agreements, and that's where the smart contracting really stood out compared to other technologies. I mean, even if you look at AI now, we can, for example, process these via AI algorithms, but no one really knows what's behind them, especially these end users, whereas smart contracting actually creates this transparency that's really interesting, and it adds the automation piece to it, which is a massive bonus. And that's the way we kind of look at things. What we do is we digitalize and create a digital representation of the physical agreement between these stakeholders, code it and deploy it. And what's really interesting again is that we then let the smart contracts work independently of us as well. We just make sure that we're collecting the right data. We drop that into the data lakes and we let the smart contracts do their thing. So even we don't have the opportunity to mess around on that level.
So it's that ability to decrease bias. And I think that's the biggest thing we're seeing, especially from healthcare, whether it's legislature currently both in the United States or UK and overseas. Like, I think that's what drew me when we were talking about the initial interest of healthcare and crypto, is that ability to take the bias out and just take clean data and then interpret that data based on, just cold hard facts and emotion, not emotion-based care. And that's, I think, a perfect route. Take us down both routes, and you can start either way of both Digipharm and DigiHealth. Like, how do they separate, and kind of where do they separate, both for the end user, but also for people like myself that are medical professionals, and like how they can go both routes?
Yeah, so typically, the DigiPharm platform, it's called the reimbursed platform, which is essentially that B2B contracting system. That's applicable for any type of health technology or an outsourced service. So as long as there is some sort of performance threshold that we can measure and track, or some sort of promise of patient benefit or efficiency for a health system, we can deploy that and run that. That's typically informed by the clinical outcome data that we collect from medical records, or even activity data directly from the hospitals. If we're looking at things, at the service level, or devices that are supposedly supposed to, reduce a waiting time or accelerate some sort of process. The other aspect is obviously the patient feedback and the patient input. So value-based healthcare, a big driver of that is patient quality of life. And that is essentially understanding what patients want from these therapies. If I give you a very simple example, you can have a drug that will reduce a blood sugar level, but it might give a patient a really bad side effect that affects their daily mobility. And that's something that the patients don't really want. So getting that input directly from the patient is really important to understand how valuable these things actually are. Because if you think about it, when you go to a hospital and you seek treatment or you're admitted, what you actually want to be is disease-free, and you want your quality of life to be good. You don't care about receiving a particular brand name of drug. You don't specifically care, to be honest, if about the reduction in the level of a specific biomarker or something like this. What you really want is the actual cure and the ability to live your life. You want to be able to leave that hospital, carry on with your daily activities, see your family, go on that delayed vacation, and that's something that's healthcare is trying to move towards, but without systems like ours, it's been really slow. And building on that patient feedback ecosystem and the credibility based on the organizations we're working with, we're looking to expand that and really make DigiHealth a portal or ecosystem where you can keep your medical data there. You can provide feedback that on services you receive that other patients can see, so they can make better informed decisions. You can access telehealth consultations with people around the world, namely physicians, physical therapists like yourself, even hopefully dentists in the future. And also creating the DigiHealth marketplace where our users can actually purchase different services, because if I just take the example of the UK health system, the quality of care has deteriorated so much that's essentially an emergency only service, and you don't get the benefits of different things like screening and stuff like that. But in other countries you may, but you might not get that expertise. So we're trying to create a one-stop healthcare ecosystem where you can help fill the gaps, independently, because healthcare and being healthy and well-being, the predeterminants are what happens on a day-to-day basis, not that 20-30 minutes you're at the doctor's clinic.
No, and I think
Definitely. Health is wealth, and health dictates the future of our life. So quick question, what partnerships or collaborations are y'all established to support its mission and enhance the platform's capabilities?
So, in terms of the let's say stakeholders who are using the platform, we're working with the National Health Service in the UK. I think that's a reference site for a lot of countries around the world in what they do, especially in the health economics space. So it was important for us to be able to work with them. We're working with one of the largest governments in the Middle East. Since that's not announced yet, I can't really share the name yet. And also one of the largest private hospital chains within that region. As part of these projects, we're working with several of the top 10 pharmaceutical companies or the top 3 medical device manufacturers. We also have implementations going on in Europe and Africa as well. In terms of tech partnerships, I think we had an interesting journey. We initially started out on Hyperledger and then moved to Corda, which enabled us to add legal pros to some of these smart contracts. Obviously, working with these enterprise, organizations, this was something that they required. And now recently, we've been onboarded onto the Hedera Innovation Program. So that's again a high quality enterprise level system. We also have, our digital currency, which is used for patient incentivization and rewards. It's a utility token that's regulated within Switzerland, and that's currently built on the BNB chain.
I love it. I think that's the big key, is how do we incentivize, as you know, between the 3 of us sitting here, crypto won't take off, or any of these technologies won't take off unless we incentivize, new users to onboard. What are the biggest incentives from your perspective? Is that patients allowing these companies to share their information? Is it accomplishing certain tasks on top of it? Where's the biggest incentivization structure for your guys' token at the moment?
Well, at the moment, I'd say that's, until the DigiHealth app is fully deployed, especially the public ecosystem, those aren't currently live yet. What we have is obviously the B2B, patient feedback collection. But obviously, DigiHealth is currently being built, and it should be out, by the end of Q3 at the latest.
Okay.
And there's a couple of areas. So obviously, by helping patients, have ownership of their medical records, again, we want to give them a share of that monetization. I remember when I was working in the pharma industry, I purchased 1,000 patient records with late-stage lung cancer. This cost us $250,000, and this went to another company, and patients didn't see any of that. And that really opened my eyes to the value of some of this data. And if you think about the fact that we weren't the only organizations purchasing this type of data, that the amount of value or capital that's completely ignoring patients and the people who actually own this data was quite startling, to be honest. The other aspect is we have a move to earn program, so rewarding patients for specific activities, and we have AI partnerships where we can actually, monitor things like someone doing a specific movement, a stretch, a press up, or a sit up, and we also have a move to burn program as well. So the Move to Burn program is very much linked to the DigiHealth marketplace. On the DigiHealth marketplace, 50% of our profits are actually redirected back to these community initiatives. So 50% of our profits are used to do a token buyback mechanism. This is then directed back to a community initiative where they can vote if these tokens are used for patient rewards, for marketing or for the Move to Burn program. And what that means is essentially if they do choose, to take it to the Move to Burn program, we might one day say, okay, we've got 5,000 tokens today that have been bought back. If the community, do 5,000 press ups, we'll burn these 5,000 tokens. So that's something I think we want to, that will help us create a really engaged community that are with us for the long term. And there are many private hospital organizations that we're working with currently that will actually be deploying DigiHealth. They understand that they can really help patient retention and partnership with these patients. And if patients feel involved in their care, they're going to keep coming back to these organizations.
Yeah, it's that locus of control aspect. I think that's the biggest thing that really, after obviously, like you talked about, just being exposed to any type of cryptocurrency is when patients can take care of their own health, then it kind of empowers them to seek solutions. And also then when they can see data, like you said, which is why I think if value-based care is done correctly, I think we can drive a model where it incentivizes individuals to seek health, but then also see numbers where maybe this person wasn't the right person for me because they're not getting me the things that I need, or the same thing you said to the pharmaceuticals, like it's a better and more transparent system to then make informed decisions, which is what we're kind of dealing with currently. Is we see a lot of things where we're told that it's this, but then we come to find out, 2 to 5 years later that it truly wasn't. But with on-chain data, I think this is kind of the next step of better transparency with unalterable data. And that's a really exciting point. I mean, for yourself and for myself, and even with Sean and some of the business that he's doing, it's going to help him decide which products are going to be better to, sell, but also create actual results and data that he can use. Are you guys creating NFTs as well then to own that data, or is that going to be something?
Yeah, I mean, we're going to create essentially a community health data set. We're going to use some sort of NFT model to do that, so we can create some sort of shared ownership to that. But at the same time, we do want to enable external investment into this data set. If somebody wants to invest in this data set and they want to have a shared ownership of the long-term benefits, patients will get an earning. They're going to earn longer term when this data set is going to be used. And I think that's really exciting. I think the most exciting thing about all of this is right now we have an opportunity to make the patient voice extremely powerful.
Yeah.
As the end consumer, typically patients have been largely ignored and they have to follow the whims of these organizations. And right now we have, especially with this value-based healthcare model, that every healthcare organization worth its weight in salt is really adopting these types of things. And if you go to Google search and you type and you learn about value-based healthcare, you see that this is actually happening now. So the more power we can provide to the patient at this early level will bode us well for the future. And at the end of the day, we're all patients, and the way we're building it is as if how we would want to see and experience healthcare.
Definitely. Now, as you're building and getting ready to scale, what are some of the potential barriers and resistance that you've encountered while advocating for a value-based healthcare? And how would y'all address them, or how are you going to address them?
So in terms of the biggest barriers, I think a lot of it was market readiness, and we've experienced that over the last 5 to 6 years. But fortunately, over time, and especially in the last 12 months, it's generally widely accepted, and the majority of healthcare organizations we talk to are starting to work in this way. If they haven't yet, they're definitely planning to. So I think that was one of the biggest barriers that we faced. There are other areas, I think, is the immaturity of these organizations of working in this way. You have to think about outcomes and payments and what you're going to base these agreements upon. Requires some sort of modeling or forecasting experience and support around the health economics behind it, and that's something that we see is quite limited. As an organization, we can support them, but at the same time we want to try and remain as independent as possible and let these organizations agree what they're going to agree between each other. We can help them understand what they can and can't do according to the data that they have, the quality of the data, the completeness, and then deploy it for them.
Definitely, mixing the different systems of incentive-based models and value-based models mixed with decentralization. I think it's slowly going to transform the world, and it's going to appear in front of us without us or before we even realize it. So it's very interesting stuff. And yeah, man, definitely anxious to see it grow.
No, definitely. I think there's a big opportunity, right, to make healthcare more sustainable. All we hear about, I mean, especially in the UK, where it's a nationally funded health system, and there's not even many private healthcare providers. It's really limited, and all we hear about is this service is struggling or this service is not available. And when you're talking about an advanced economy in 2023 not able to provide basic care, it's embarrassing, to be honest. So
definitely, and it's about time for these legacy systems to get replaced. And yeah, I'm very excited to see multiple decentralized models implemented in various industries, and it's very cool to see.
Yeah, definitely.
I had a question for you, Ahmed. This is something I've thought a lot about. How resistant are some of these hospitals or private companies towards just when you introduce like the ledger or the cryptocurrency itself? Like, is there a pretty accepted understanding? Do they have a team for that? That's the biggest question I've always wondered. Like, how are they receiving when you start bringing up some of that, ledger or any type of cryptocurrency involvement?
Yeah, I mean, so in terms of the ledger, initially at the start, blockchain and things like that, especially a few years ago, they thought it was some sort of scam or a technology they couldn't trust or understand. More recently, I think they've gained acceptance, especially since what's happened with COVID and the digitalization push in healthcare after that. I think they realized that, their reluctance or unwillingness to embrace new technologies was damaging them and damaging patient outcomes. And I think that's relatively changed. In terms of the cryptocurrency aspect and the rewards, I think there's much greater acceptance in emerging economies. They're much more willing to utilize them, and they're open for them. In terms of other more advanced economies, I think they have a lot more regulatory concerns, or they have a much weaker understanding. But I think for that, we've been focusing on some of these other countries, and without us even mentioning, or trying to push them to using some of these reward mechanisms. Once they see it, they're the ones who bring it up to us, and that's been really refreshing, especially in the Middle East.
Well, and I think that's where things are going to change. We are kind of like Sean has talked about, seeing transitions of power in the sense of a lot of these developing nations or kind of those in-between nations are starting to push the forefront of technology, which is probably going to potentially vault them ahead of some of these, economies that are at the current, world status just through things like this. Like the thing that stuck out to me that I thought was amazing was the ability to decrease admin cost. I mean, in the United States here, that's like the number one killer of healthcare is just the high burden of admin costs. And I think when you create a lean environment, which is what it sounds like the mission and vision is, especially, I think that's going to be a unique proposition, especially when people from those developing countries can access it with a phone. Like they can see whoever they need with just a phone and a cell phone. I think that's such a unique way that's going to push things forward.
Yeah. I think also in some of these countries, it's also the political landscape that enables some of these top-down decisions to be made. Once there's a mandate from the top in some of these countries, it's all hands on deck to push that shift. We had an experience in working with some stakeholders in the US. It was a top 10 pharmaceutical company, and it was a pretty large hospital that both wanted to implement a value-based agreement, but then in between we had a PBM who wasn't willing to play ball, right? It would have cut their profits. And they weren't really willing to support the implementation of a business model like this. And there were also some situations where, we were encouraged or directed to speak to local politicians who can lobby for us and things like that. And that's when I thought, okay, this is a market we need to step away from right now. It's not something we want to get involved in. Let's try and prove our solution elsewhere. And if the environment becomes friendly in the future, then that's something we will consider.
Well, and I think that's the sad part, like you said, is one of our systems like the UK. I mean, both Sean and I are out of the US, are facing a lot of those similar issues. Maybe not to the extent of, we're still a privatized healthcare system in a lot of ways. But that's the hardest part, I think, is you're pushing out a lot of technological innovation in these larger countries that could probably rapidly iterate it and make it really good. But I think, like you said, that innovation is going to come from these people that are willing to take those risks and make that change. And I think that's going to be the coolest part about this. So I'm super excited. Like, I think this is such a great product. It's similar in ways to kind of what we're doing with some of the team at Elite, which is one of our web services that are run by Johnny, who you met briefly. But I think that's going to change with this decentralization. Is we can have multiple companies, working together and then also kind of running parallel. So I think that's huge. Sean, you got any really big business questions you've been thinking about too? Like, I think there's a lot of cool things that can come out of here.
Yeah, I mean, we've kind of hit on a few of my questions, him just speaking, covering a wide range of knowledge. But I do have one question that I was curious about. How do you envision the future of healthcare under value-based models and incentive-based programs? Like, what is your vision of those two transforming in the next 5, 10 plus years?
I think value-based healthcare will become the predominant business model within healthcare. I think we're going to have a situation where personalized medicine will increase because of it. Obviously, when healthcare manufacturers are being rewarded for providing good outcomes, they're going to, I think, spend a lot more on their R&D on the, personalization or targeting and making sure that the patients that are going to receive the care that will actually benefit them. So I see, value-based healthcare being, widespread. I see personalization becoming widespread because of it. Otherwise, there isn't too much of an incentive to do that, right? Because if you're getting paid anyway, whether someone benefits or not, what's the incentive for you to create these, tools, diagnostics, whatever that may be? So I think diagnostics markets are going to boom. I think that's going to be a really, really interesting and exciting space. Healthcare will be driven, mainly by a lot of these diagnostic tests and assessments. So that's something I think to keep a lookout for. And in terms of, incentive-based incentivization and stuff like this, I think patients will be, more willing to work with these or go to these organizations that treat them like partners and give them a holistic understanding of their healthcare and not just an emergency treatment or anything like this. I think what we're going to have is a situation where patients can monitor and understand and be able to change their behavior based on what some sort of device or remote monitoring tool is telling them. And in order to get the patient to continue to engage and keep sharing data with you, there needs to be this, incentive model in place.
Definitely. I am a very big believer in decentralization, and I think it needs a makeover and all over the world. So can you explain to the users how your company utilizes the blockchain in simple terms, just in case we have some listeners not fully familiar with the technology?
Yeah, so on the contracting side, we use the blockchain as a, let's say, authentication and audit layer around the data that's used to inform some of these agreements. This could often be, data directly from medical records or data that's coming from specific tests or medical devices. And we use a smart contracting layer to process some of this data against the contracts that these healthcare organizations have between each other. In terms of the DigiHealth application, we mainly use, the cryptocurrency element of blockchains, really as a patient reward and tokenization model.
Awesome. Now, I heard that you're going to be working with HBAR very soon. Could you tell us tell us a little bit about HBAR and what makes you excited to use their platform?
So they're an enterprise level solution. They enable us to manage huge amounts of data without any issues around scalability. They can manage a high throughput, and if, for example, we're collecting or basing some of our outputs on masses of patient data, activity data, and things like that, it's a solution that has been shown to really be able to handle these types of things. What's also really interesting about HBAR is that some of its let's say its validation layers are actually public, but it's still a private permissioned blockchain. So actually, I think that's also quite cool about Hedera.
Definitely, a lot of institutions love that private aspect for sure. I haven't built on HBAR yet, but I'm definitely getting closer and closer to check it out more and more. Right now, we've been more so on XDC network, and I had a couple projects on XLM. So yeah, it's very interesting stuff. I've heard a lot of great things about HBAR. Are you familiar with XDC?
No, not yet, but I'll definitely check it out.
Check it out. They're doing a lot of great things, a lot of moves in Dubai they're making, and yeah, some high-level security aspects as well. So
yeah, no, that's good. I think what's been missing, I think, from the blockchain ecosystem is a protocol that can enable us to have or implement, private permissioned implementations, but at the same time have a public token economy that we can, build all within the same protocol. At the moment, obviously, we're using BNB chain for the public, token ecosystem. But I think when maybe on HBAR eventually we could potentially deploy our token on there. But I mean, let's see. It depends on what the users want and what the end users will use. The reason why we use BNB chain is it's one of the most accessible or easiest to use for the public. There's nothing in terms of the technology that stood out from any other blockchain, but it's more about that wider reach.
Definitely. Now, what is your opinion of when mass adoption will be driven mostly? What is your vision on that, on getting the masses into blockchain while we're building ecosystems and creating all these platforms? When and what do you think will push mass adoption?
In healthcare or generally?
I'm say generally, just generally in the blockchain and trade finance world.
I think the collapse of the institutions that we're seeing right now, right? I think people, I hope they're going to wake up this time, right? They didn't wake up in 2008, but we didn't have anything like this in 2008. This is the only time I think we're going to have, where we are in some sort of, recession. Some people say it's not, some people say it is. I think we can all see in front of us, even though people are telling us it isn't, especially those at the top, we can see what's happening. And I think this will be it's the first time we're going through this, as an industry with, the macro situation as it is. I think people will start to realize that they're being told lies over and over and over again. And I think that, I hope, is going to be a big driver for a migration away from some of these old systems.
Definitely. I think I see so many events and timelines getting ready to merge that I only see something big happening that could destabilize the system. And then we can implement this new system that we're building and change the world for better, level the playing field, decentralize the world, and just put everybody on the same level. I think that that's truly needed. So,
yeah, I smile because I know what this technology can do, and I know it works. And I mean, it's different if we were people who are not working on these technologies day in, day out that say, oh, this is going to change this, or this can replace this. But this truly can. And, I'm very convinced that it will happen. So, that's why, as you mentioned, there's a lot of things falling into place at the moment, which are saying it will. So.
Well, and I think that's the key. I know Sean is going to be probably talking about it on another podcast he's on, but I think that transition to microeconomies is going to be the biggest thing. I mean, we just see Texas going into gold-backed asset and creating their own potential way to create a basket of currencies that they can transact with, I think is a higher level of what we're trying to accomplish in the currency space. I mean, I think more and more the fluidity of tokens and transactions are going to be based on backed assets versus, a global reserve asset more than likely, just with the way our timelines are going. So I think it's spot on. Like, it's going to force us to deconglomerate pretty much. Like, I think a lot of people are going to have interoperability between their own economies, but eventually be able to take it out based on solid fundamentals of things that actually are value. It's value-based care. It's really just value-backed tokens too. And I think that's going to be the future as well. So, I think those are our biggest things. So yeah, man, I think, like you said, the same thing. People laugh at, Sean and I get it all the time. It's like, just like you said, we see it every day, like how much this can change. And it's just, how do we get that education piece out to the masses and make it simpler? Because that's the biggest issue I think you probably run into, is like, how do we onboard people to make it easy, where it's just like you click a button like you would when you go onto your bank account. It's log in, username and username, password, or biometric fingerprint. And once we get there, I think that's going to be, in my opinion, the mass adoption stage.
I think especially the next generation when they grow up. Right? I've got kids myself, and they grew up around tablets and laptops and stuff like this. When I was growing up, we didn't know what computers were until we were 11, 12, 13 years old, and that's so I'm hopeful for the future. Well,
and I think too, like, and this is what I thought a lot about too, is like, the reason that 5 to 10 years kind of falls into place, of our timelines is, that next generation that's leaving inheritance and stuff is going to people that are looking to put money and assets into other things. And I don't think it's just like what it used to be, which is like buying a house or this. It's like, well, what are these digital assets that we're doing? And then they have a surplus of funds. And I think that's another catalyst that we don't always talk about, but really that's a sad reality. It's the things that come in when people pass, and the new generation that's familiar with, all this technology and AI. I think that's going to be a big flow too, which will be really unique, because it is much different, and we're seeing it built as we go versus, some of these legacy systems.
No, I think AI is, the developments within AI, especially the last few months. So obviously, ChatGPT was a big catalyst, but then all these different plugins that are stemming from that, and then all that stuff is really exciting. But also, I think there needs to be some sort of responsibility around how it's used, because it can be used, dangerously, and that's something we all need to be aware of.
Well, like you said, I think it's got to be open sourced. I think that's the biggest thing, is we're not seeing right now in AI, is like, how are they coding it? How are they functioning it? And what type of bias is being put into it?
Yeah, where's the data going? Where's the things that we ask it? Where's it going? How's it being used? Can it be used against us? I think security, and especially cybersecurity, needs to step up the level in general. And otherwise, I think we're all going to be pretty vulnerable.
Yeah, I think it's been great. Sean, do you got any big burning questions or anything else before we wrap it up? And kind of let Ahmed tell us where he can be found and where we can find all of his products.
No, I think he was very informative and covered a wide range, but I definitely would like to follow up with you in the future, and definitely keep an eye on your progress. So if there's anything we can do, don't hesitate, reach out, and man, we'll definitely stay in touch.
Well, thank you guys, and it was great to have a refreshing conversation. So some of these things I can't say in some of the meetings I'm in, so it's always great to have like-minded individuals and people who think about the future the same way. So yeah, thanks for having me, and definitely would love to catch up soon.
Yeah, we'll keep you in mind, but like let everybody know where we can find you. Where's your Twitter, Instagram, website?
Yeah, so our website is digipharm.io. Our Twitter is @yourdigifarm. And we also have the Twitter for DigiHealth, which is @yourdigihealth. And from there, you can find everything you need to know.
Amazing, man. Well, like I said, it's been a pleasure. Like I said, we want to get everybody together in this community and really help get out these products that I think are going to change the world. But we just want to wrap up and say just another great episode of the HealthFi podcast. And we'll just be shining off with myself, Dr. Eric Krieger, and my co-host, Sean. Everyone have a great night.